Hello မင်္ဂလာပါဟုတ် Hello မင်္ဂလာပါအဲ့တော့ကျွန်တော်ခဏလေးတော့ဆောင်ပေးပါခင်ဗျဟုတ်နော်ဟိုကျွန်တော်ဒေါက်တာကန်ဘွန်လည်း join မယ်ဟုတ်တခြားဆရာမကြီးလည်း join ပါပါဟုတ်နော်မင်္ဂလာပါဟုတ်ဟိုနေ့နေဟိုဒေါက်တာကန်ဘွန်ကဟုတ်ပြီးပါရင် join ပေးလိမ့်မယ်ဟုတ်ကျွန်တော်ကကိုဒီလေးကျော်ပါဟုတ်ကျွန်တော်ကအဓိကဟိုနေပေါ့နော်ဒီ meeting အတွက်ကျွန်တော် technical support လုပ်ပေးတာပါဟုတ်ကဲ့ပါဟုတ်ကျွန်တော်ကတော့ဒေါက်တာမဟုတ်ပါဘူးကျွန်တော်ကဒီ ID ဘိုင်းရပါဟုတ်ကဲ့ ID technician တယောက်ပါဟုတ်ကဲ့Hello good evening sir
Good evening.
yeah hello good evening good evening sir and madam yeah today more participants were joined for this meeting
Okay.
Yesterday they have another meeting for their organization. So yes, today more participants were joined.
Okay. Okay, so we just wait.
Yes. Because now yes at 2:15. Yes, 3 p.m. we will start it. Yeah.
Okay, it's allowed 10 minutes. And can you please set me as co-host, please?
Yes. Sure.
Okay.
Now yes, I already made.
Right, no problem. Thank you. Yes, thank you.
Yeah, welcome.
Just case it. Good.
Hello Dr. မင်္ဂလာပါဟောဒေါက်တာမင်းပညာဟုတ်ကဲ့မင်္ဂလာပါဆရာဟောဟုတ်ကဲ့ဟောကျွန်တော်ခဏနေလို့ရှင်တော့ဟောဒေါက်တာကန်ဘွန်နဲ့စပြီးတော့လေကျွန်တော်တို့ဟော discussion လေးစပါမယ်ဟောနော်ရှင်ဆရာလည်းရောက်နေပါပြီဟုတ်ကဲ့ဟုတ်ကဲ့ပါဟောကျွန်တော်ကတော့ကိုဒီလေးကျော်ပါဟောကျွန်တော်က IT technical support လုပ်ပေးတာပါဟုတ်ကဲ့ဟုတ်ကဲ့ဒီ Zoom နဲ့ပတ်သက်ပြီးတော့တခုခုပေါ့နော်ဟောကျွန်တော်တို့ဒီပေါ့နော် technical IT ဘိုင်းနဲ့ပတ်သက်ပြီးတော့သိချင်တာရှိလို့ရှင်เนาะကျွန်တော်မေးလို့ရပြီပေါ့နော်ဒီနေ့ကျွန်တော်ရဲ့ဒီ stem cell အကြောင်းပြောမှာကတော့ဒေါက်တာကန်ဘွန်ကပြောမှာပါဟုတ်ကဲ့เนาะဟုတ်ဆရာလေးရောက်နေပါပြီဟုတ်ကဲ့ဒေါက်တာဟောအီတင်ဇာဟောဒီလေး mic ကိုအဆင်ပြေလားမသိဘူးဟော mic လေးတော့ off ထားတယ်ဟော
ဟုတ်ကြားရလားမသိဘူးရှင်
ကြားပါလေခင်ဗျဟုတ်ကဲ့ဟုတ်ဟုတ်ရှင်ဟောဆရာမမင်္ဂလာပါဟုတ်ကဲ့
ဟုတ်မင်္ဂလာပါရှင်
ဟုတ်ကဲ့ကျွန်တော်ကကိုရီကျော်ပါဟုတ်ကဲ့เนาะဟုတ်ဒေါက်တာကမ်မိုလည်းရောက်နေပါပြီဟုတ်အဲ့ဆိုကျွန်တော်3နာရီလေးထိုးပြီးဆိုတော့လေနောက်လူတွေလည်းသူဝင် join လိုက်မယ်ကျွန်တော် video recording လေးလည်းလုပ်ပေးထားတယ်ပြီးသွားရင်ကျွန်တော်ပြန် share ပေးမှာဆိုတော့လीဟုတ်ကဲ့
ဟုတ်ကဲ့ဟုတ်
ဒါဆိုရင်ဆရာနဲ့စပြီးတော့ပေါ့เนาะကျွန်တော်ဟိုပေါ့ introduction လေးစပြီးတော့သွားပြီးတော့ stem cell အကြောင်းလေးသွားကြည့်အောင်เนาะ
ဟုတ်ကဲ့ဟုတ်
Mr. Cameron yeah
Yes.
Yes, and now yes, we start the meeting.
Okay.
Yes. Now yes, the participant is Miss Itinza and yes, Dr. Mimpanya. Yeah.
Okay. So let me introduce myself. My name is Dr. Kampon Sri Pathanakun. I have been working in Mahidol University for a long time until my early retirement. At present, I'm developing my own clinic and medical center, promoting so-called medical tourism and also wellness tourism. What I would like to do today is to share with all of you about stem cell therapy. During the past 20 years, I have been involved with stem cell research and stem cell clinical study with many countries. And I think that this is the right time for medical professionals all over the world to understand more how we can use stem cell therapy in medical practice. So let me start with the presentation. After I finish presentation, I would like to welcome all of you to ask any question or any comment, and I'll be able to give you my answer. Okay, let's start with the presentation first. Today, the topic will be on current application of stem cell therapy in the treatment of chronic diseases. Let's start with what are stem cells. All stem cells, regardless of their source, do have three general properties. The first property is that they are capable of dividing and renewing themselves for a long period of time. The stem cells are so-called unspecialized. It means that it doesn't get turned into any specific organ and tissue. And they can give rise to specialized cell type. The promise of stem cell research can cover a lot of treatment concepts that we can use for treating many diseases in the near future. On the left-hand side, many scientists are working on tissue engineering, and we are attempting to grow tissue and organs from the test tube. And there have been enough research that prove that we can now grow skin tissue for those patients who have burns and wounds. In the near future, we expect to be able to prepare many other tissue and organs ready for transplantation, but it might take another 30 to 50 years before we can come up with the complete organs for transplantation in the future. If you look at the middle part of the presentation, we will now spend time talking about cell transplantation. And right now, there have been many studies and using stem cell for treatment of many diseases, which I will give you more detailed explanation later. On the right-hand side, you can see that we now can use the research for gene therapy and for gene diagnosis. So with all this, we can start now with understanding about what would be so-called genomic research. At present, in USA, they have completed what they call International Human Genome Project. We do understand now how many genes exist in human body and what are the functions of each gene. What have been promoted so far will be DNA test or gene test to predict health risks or risk for causing cancer, Alzheimer, and many other diseases. As we all know, gene control protein synthesis. So we have now using a lot of so-called peptide and growth factors for treatment of many diseases as well. Let's talk a little bit about history of stem cells. Stem cells actually is not new. Stem cells have been around for as long as life exists on Earth. All life form, starting from the cell called stem cell. For stem cell research, we have started in the early 1950s. There are two scientists from Canada, Dr. Ernest McCulloch and James Etienne, were the first one who identified stem cell in bone marrow. And after that, stem cells have been approved for clinical use starting from the year 1962. So far, there are more than 1 million bone marrow stem cell transplantation occurring in the world. I just like to tell you that starting from the year 1968, the first bone marrow transplantation was successfully used in the treatment of severe combined immunodeficiency disease. And since 1970 onward, bone marrow transplantation have been used for treatment of many immune disorders and blood cell cancer, including leukemia and lymphoma. In this slide, it shows many types of stem cells. On the left-hand side, you can see single cell embryo. When sperm and eggs fertilize, it will turn into zygote. And with this single cell embryo, scientists can develop so-called cloning technique. The cloning idea is to take out DNA from the donor and replace it with DNA that we want to clone. And the first first animal that had been cloned successfully is called Dolly the sheep in Scotland around the year 1960 something. After that, cloning has been banned, not allowed to be used for human. However, there are still a lot of progress in animal cloning to replace so-called distinct species. If you follow the slide, you can see that during the 5 to 7 days after fertilization, we will come up with the stage of cell called blastocyst. And if we break down this blastocyst, there will be several inner cell mass which can turn into so-called embryonic stem cell. embryonic stem cells have not been approved for use in clinical application. However, we are able to do a lot of embryonic stem cell research to understand more how stem cells work. As you can see further, during 5 to 12 weeks of gestation, fetus tissue will be developing. In Ukraine and Russia, they have been using fetal tissue stem cell for transplantation in patients who could not be treated by conventional medicine. However, using abortion material are considered to be illegal in most countries, including Southeast Asia. Today, I will give more focus on adult stem cells, which have no ethical problem, and many types of stem cells have been accepted in clinical practice. If we want to classify stem cell by cell origin, we can classify into 3 types. Embryonic stem cell derived from the inner cell mass of blastocysts. Embryonic germ cell can be collected from fetal tissue at 5 to 9 weeks of gestation. Both of these 2 types of stem cells are considered to be unethical and illegal in almost all countries in the world. So we now focusing on adult stem cells, which have been derived from mature tissue. Just to take a quick look at embryonic stem cell. You see the cell called blastocyst. Inside blastocyst, there are around 100 tiny cells called inner cell mass. And when we incubate and culture further, inner cell mass can turn into 3 different germ layers. The first germ layer is called ectoderm. Ectoderm can turn into skin, eyes, and nerve. Mesoderm can turn into bone, blood, and muscle. Endoderm can turn into lungs, visceral organ, and liver. For development of embryonic stem cell research, scientists would like to turn so-called pluripotent embryonic stem cell into specialized cells. And once we turn them into specialized cells, we then transplant into patient. So that's something need to be done for a longer time to prove that it's safe, ethical, and can be allowed to use in clinical practice, but not during this time. Let me show you the other exciting source of stem cell called induced pluripotent stem cell, or iPSC. Many of you may have heard about Professor Yamanaka in Japan, who received Nobel Prize about 5 years ago. He's the one who invented the technique of turning skin cell, reprogramming the cell by using stemness gene like c-MYC, KLF4, OCT4, and SOC2. And this skin cell can be turned backward into so-called embryonic stem cell. And these are the things that has been undergoing a lot of research, but have not yet been implemented for clinical application. Let's come now to adult stem cell. Adult stem cell usually start from the mature cell, but the word adult doesn't mean that it has to be collected from the grown up. We can collect first adult stem cell from the baby when the baby will be born, starting from cord blood and umbilical cord tissue and placenta. And later on, we can collect from baby teeth, from bone marrow, from the blood of the patient, the fat tissue, and so on. adult stem cells, they have quite interesting property. First, they can make identical copies of themselves and keep it for a long period of time. This ability to proliferate is referred to as long-term self-renewal. Secondly, they can give rise to mature cell types that have different characteristics and morphology and specialized function. This picture shows the difference between so-called adult stem cell and the other type of cell called progenitor cell. Just to repeat again, stem cell, when they divide, they will divide asymmetrically to produce an exactly identical copy of its own and save it for using to repair ourselves. The other cell that being divided will turn into so-called specialized cell. Now, scientists have found the cell called progenitor cell. For example, in this picture, this is a picture of myeloid progenitor cells. When this progenitor cell divide, it can change into the blood cell, such as neutrophil or red blood cell, as shown in that picture. At the beginning, most doctors and scientists understand that stem cell from bone marrow can only treat blood cells, such as red blood cell, white blood cell, and platelet. However, during the past 2 decades, we realized that stem cell from one tissue can differentiate into another tissue. For example, if we take mesenchymal stem cell from bone marrow, it can turn into muscle, brain tissue, skin, and muscle, as shown in this diagram. We start to understand more the activation pathway that stem cell can differentiate. We do understand a lot of things about so-called migration factors and growth factors that activate stem cell to differentiate. Growth factor usually released by damage may induce stem cell to home to a particular tissue. And with certain growth factor and cytokine, it can activate the gene and make the stem cell to be able to reside in the new tissue. And there are many pathways that we understand about migration and differentiation of stem cell. But this is probably take much long time to make the presentation today. So maybe we can do more advanced lecture on how stem cell works in our next group of lecture. Now, let's come more simple one. What are the sources of adult stem cell? The first group is called hematopoietic stem cell, which means that they are stem cells that can create blood cell type. They can be derived from bone marrow and peripheral blood. Just to repeat that, bone marrow stem cell has been used starting from the year 1962. And 1972, we start to learn to use peripheral blood stem cell. And cord blood stem cell has been identified in the year 1989. All of these three sources, repeat again, are considered to be hematopoietic stem cell. And these three sources of stem cell have been used to treat blood disease for more than 30 years in our part of the world. Now, after we have found hematopoietic stem cell, we can find many adult stem cells from placenta, umbilical cord tissue, liver, fat tissue, and baby teeth. When we start to use stem cell for the treatment of chronic diseases. The plan is to develop a new branch of medicine called regenerative medicine to treat degenerative diseases. In brief, regenerative medicine is a broad definition of innovative medical therapy that will enable the body to repair, replace, restore, and regenerate damaged tissue and organs. This broad field of medicine covers a variety of research areas, including cell therapy, tissue engineering, biomaterial engineering, growth factors, and transplantation science. Let's now move to cell therapy. US FDA defines cell therapy as the prevention, treatment, cure of disease or injuries in humans by the administration of autologous. Autologous means that the donor of the stem cell will be the patient, and after processing, the stem cell will be put back to the same patient. Allogenic means that the donor are different person from the patient. It's called allogenic. Xenogenic means that the stem cell or cell products come from animal species. And this kind of cell therapy have been manipulated or altered in the outside environment, also called ex vivo. If we talk about human stem cell transplant, there are actually 3 types of stem cell therapy. The first one, autologous. The donor will be the patient himself or herself. Allogenic, the donor will be from somebody else. It is advisable to use related donor just to make sure that the matching will be better than using unrelated donor. The other term is called syngeneic stem cell treatment. Syngeneic means coming from the identical twin. With this, there's no need to do any tissue matching or cell matching. This slide compare autologous and allogenic stem cell. With autologous, tissue matching will not be required. No rejection, no complication called graft versus host. Engraftment, that means that the stem cells start to regenerate the tissue are faster. Immune reconstruction is also faster. And we don't have to worry about infection material that may come from the donor because it's from the patient himself or herself. In contrast, allogenic, many types of stem cells need to be proper matching first. If they are not properly matched, rejection may happen. And the side effect is being called graft versus host disease can be possible. Engraftment is a bit slower. Immune reconstruction is also a bit slower. And the possible of contamination from viruses such as HIV and hepatitis are also possible. This is just to show you how we do HLA or human leukocyte antigen matching for organ transplant or stem cell from the blood before we go to give it to treat patient. Human leukocyte antigen have 6 sets of genes. Usually we have to do perfectly match to make sure that no rejection or no side effect will happen. This diagram confirms that if we are doing so-called autologous transplantation, or if the donor are identical twin, there are no need to do tissue typing. However, for allogenic, the chance of matching will be better to use related donor than unrelated donor. Graft versus host disease, or in abbreviation we call GVHD, can occur if stem cell or tissue and organs are not perfectly matched. Acute GVHD will have a lot of serious side effects. It can affect bone marrow, intestine, and liver. Chronic GVHD usually affects the skin, nails, and some other tissue. It can develop 100 days after stem cell transplantation. We have now been able to understand quite a lot on how to make cell-based treatment successful. At least we need to proliferate extensively and generate sufficient quantity of tissue to make it work. In general, if we are to do stem cell transplantation, we will need the average dose of 1 million cells to 2 million cells per kilogram body weight. For example, if a patient is weight about 60 kg, he or she will need around 60 to 120 million stem cells to be infused. Now, with each transplantation, we usually give around 20 million at a time. So if we have to give a larger dose, we usually spread into 3 to 4 sessions, about 1 week apart. When we select the proper type of stem cell, we need to understand that they will be able to differentiate into the desired cell type, be able to survive in the recipient, integrate in the surrounding tissue, and function appropriately for the duration of recipient's life. The two key success of stem cell transplant is called homing and engraftment. Homing refers to the respective stem cell to be able to implant it into the damaged organ and tissue. And they usually find their way into the organ as if attached by it. I have to make sure that we understand that implanted stem cells are not being attacked by healthy organ, tissue, or cell. It will go to heal only damaged and injured tissue and organ. When stem cells do homing effect, we expect to have engraftment, which means that the stem cells are functioning properly in the desired tissue. This picture shows some biological effect that occur after we give stem cell by infusion. There are at least a few information that you need to understand about this slide. In order to induce stem cells to go to the damaged tissue and organ, we need to have what we call SDF1 or stromal derived factor 1. And this will attack the stem cell to move from the circulation into the tissue and organ. And also the stem cell, before they can migrate, the receptor called CXCR4 need to be activated. During the past 10 years, we do really understand more how stem cells work. In general, stem cells have 3 different mechanisms of action. The first mechanism of action is called paracrine effect. Paracrine means that the stem cell will release growth factors and cytokine along the way when the stem cell move around blood circulation. And this cytokine and growth factor can stimulate tissue and organs that being exposed to stem cell. Now, vasculogenesis or making new blood vessel can occur after stem cell treatment around 4 to 6 weeks. So in case the patient have peripheral artery disease or but for obstruction, stem cell can be used to produce collateral circulation. The other term is called angiogenesis. With tissue regeneration, it will depend on the organs and tissue that we will try to help to support. Now, we also understand that the stem cell, especially so-called mesenchymal stem cell or MSC, can having so-called immunomodulatory properties. MSC can modulate function of NK cell, B cell, T cell, and dendritic cell. So therefore, we can use MSC to increase immunity or adjust immunity in case of autoimmune disease by having so-called immunosuppression effect. We bone marrow stem cell constitute the natural renal system of the body. And one of the attempt that we like to do is to try to support the release of stem cell from the bone marrow. And the stem cell being released can help the body to repair itself and maintain better health. For example, we understand that if we inject subcutaneously a product called GCSF, like in trade name is called Neupogen. This GCSF can stimulate bone marrow to release stem cell out of into the blood circulation, and by support the release, it can help to repair the damage in the body and the tissue. I'd like to explain a bit about the fact that tissue and organs have different turnover rate. For example, intestinal mucosa have turnover rate around 5 days. Pancreas about 3 months to 4 years. Lung 4 years. Heart 15 years. Brain 15 to 30 years. So the reason that is if we want to go ahead and heal certain organ and tissue, we need to know how long the result can take. For example, if I want to treat intestinal mucosa problem like colon ulcer, it will take only 5 days to 7 days to heal itself. In case of diabetes, if I want to help to support diabetic treatment, it will need me around 3 months to see the clinical result after the treatment. For lung, heart, and brain, during natural process, it will take too long time to see the patient coming back from stroke or heart disease. So if we want to treat organs like this, we will need to have higher dose of stem cell, and also giving the stem cell treatment at least 3 to 4 sessions in order to see the significant improvement. In general, if you want to give stem cell for treating lung disease, heart disease, and brain disease, we have to wait at least 4 to 6 months to see the maximum effect that can take place. This slide shows that we can divide organs into 3 groups. The first group on the left-hand side are organs which have high cellular turnover, high regenerative potential, such as blood cell, mammary epithelium, gut epithelium, vascular epithelium, and skin tissue. So if we are going to treat this type of organs and tissue, we can see significant improvement within 4 to 6 weeks only. Now, with the middle column of low cellular turnover, high regenerative potential, such as liver, small blood vessel, skeletal muscle, pancreas, anal cortex. It usually you can see the significant improvement within 6 weeks up to about 3 months. However, for those organs with low cellular turnover and low regenerative potential, like the lung, brain, kidney, retina, the heart, and spinal cord, we need to wait at least 4 to 6 months to see the significant improvement. We also come up with the idea that health is a balance between cellular loss and tissue renewal. So anti-aging medicine come up with this concept. If we can use cell-based therapy to increase tissue renewal faster than cellular loss, we can see anti-aging effect happening. In contrast, for the disease formation, is usually due to cellular loss is much faster than tissue renewal. When we compare the number of stem cells during different age group, as is shown in this slide, newborn have around 1 stem cell per 10,000 normal cell population. At teenage, it becomes 1 per 100,000. At the age of 30, 1 per 250,000. At the age of 50, will be around 1 per 400,000. And for those who are more than 70 years old, it becomes 1 to 2 million type of cell. Therefore, when we're getting older, it's also very difficult to heal ourselves. And if we want to reverse the aging or repair degenerative disease, we must be able to give enough stem cell equivalent to when we're very young. We also have studies to prove that the stem cell activity derived from children are more effective derived from adult patients. So therefore, that shows that those who are above 60 years, most of them do not have strong enough stem cells to heal themselves. So therefore, for very old patients or patients with very sick disease, we usually try to get the stem cell from the donors, which usually come from umbilical cord tissue or baby teeth stem cell. I will explain more detail about so-called autologous process. This is a picture of so-called stem cell therapy. The patient will lie next to the machine called apheresis machine. The catheter will bring the blood into the machine, take out stem cell, and return it back to the patient. There have been a lot of indication for using autologous transplant, especially for treatment of lymphoma and so on. The collection process usually takes place about 3 hours. The side effects are rare and mostly minor. And the stem cell can be collected slowly in order to get the enough of the collected stem cell sample. Within 3 hours or less, we will usually get about 150 ml volume of collected stem cell. And this stem cell for cell count and further culturing. This picture show the diagram of collection process. To start with, we need the machine called apheresis to collect stem cell from the donor. And if we want to keep it for a long time before giving back to the patient, we can keep it in liquid nitrogen tank that can keep stem cell to be viable more than 25 years. This autologous transplant process starts with collection process. And the stem cell can be collected, like I told you, from the blood or even from the bone marrow. Processing and then cryopreservation or keep it in liquid nitrogen tank and use it. We will thaw stem cell and reflect back to the patient. I have often recommend cancer patients who are going for chemotherapy that they should collect their own stem cell first before doing chemotherapy until they finish the course of chemotherapy. Stem cells that are being collected can be given back to improve their bone marrow function and also to correct any side effect due to the treatment or the cancer process. Let me spend maybe under 20 minutes to explain more about the mesenchymal stem cell. Mesenchymal stem cell has the unique property that they can be given to anyone without having to do matching, similar to blood group O. So mesenchymal stem cell can be considered as a source of universal donor. MSC were first isolated from bone marrow by Friedenstein group in 1926. Later on, MSC can be isolated from more wider cell type, including adipose or fat tissue, delta pump, like baby teeth, peripheral blood, placenta, umbilical cord, blood, and cord tissue, and so on. This picture summarizes the very good property of MSC. The first property is that it can possess what we call immunological privilege. That means that it can be given to anyone without having any immune rejection. And these type stem cells also have so-called immune modulatory capacity. And it also can produce what we call immunosuppressive property for those autoimmune diseases. This type of stem cell have been proved that it's quite safe, no serious side effect happened so far, no ethical or religious problem. And also it can be used to treat several tissue and organs, including the brain, the heart, the liver, and skin and muscle, and so on. And they do have very strong antioxidant and anti-inflammatory properties. If you have some time, please read more about this reference, which discuss about mesenchymal stem cell as therapeutics. In brief, mesenchymal stem cells have been undergone a lot of clinical trials, and it has been proved to be quite promising for the treatment of many chronic diseases. This is the picture of healthy cells that express mesenchymal stem cell markers. And when we go to characterize any type of stem cell, we usually go for what we call stem cell surface marker. For MSC, STRO1 cell surface marker will be the marker specific for mesenchymal stem cell. This picture shows the so-called mesogenic process. and showing that mesenchymal stem cell can turn, once we can do it properly, into bone tissue, cartilage, muscle, bone marrow, stroma, tendon, ligament, adipose tissue, connective tissue, and many other tissue and organs. The most common source of MSC usually come from umbilical tissue stem cell, as is being shown here. The most effective one is called Wharton's jelly. So most of the study conducted will be using mesenchymal stem cell derived from Wharton jelly. Our research scope have been conduct a lot of research on baby teeth or dental pulse stem cell. The scissor teeth have been shown that it can have quite a strong number of stem cells. If you look at the life of the baby teeth, which just being dropped from in the kid, you can see that there are 3 special sources of stem cell from the pulp. The first group will be ready to turn into bone and joint. And also, I like to recommend dentists to consider to use this type of stem cell to inject for gum disease or to strengthen the bone and joint. Okay. With baby teeth, we can see that the incisor teeth, which we have 12 teeth, can produce good enough of source of stem cell. Wisdom tooth or third molar tooth can also still produce stem cell as well. This is a picture of the clean room plus 2 that used for stem cell banking and stem cell research. Okay, this is a picture of mesenchymal stem cell, which are the cells with ability to rub into a wide range of tissue. Okay, I like to summarize that at present there are more than 100 diseases that have been approved to be treated by stem cell. Most of them fall under cancer, bone marrow failure, metabolic disorders, immunodeficiency, and many other diseases as shown here. The one that I think that we have to use more will be for treatment of thalassemia, which is also quite common in this part of the world. Okay, so far I have described that the disease that have been approved are usually going to be about blood cell disease. For the chronic disease that are being shown here, there have been a lot of research conducted clinically and in animal study. And those kind of studies prove that it can be very useful for treatment of stroke, Alzheimer's disease, bone degeneration, liver disease, multiple sclerosis, diabetes, Parkinson, ALS, heart disease, spinal cord injury, and muscular dystrophy. Let me briefly tell you about stem cell treatment for diabetes. Mesenchymal stem cell therapy can help patients with type 1 or type 2 diabetes in order to optimize their health and improve their quality of life. Stem cell therapy may decrease high blood sugar, but it can treat a lot of complications associated with high blood sugar, such as heart disease, peripheral vascular disease, diabetic neuropathy, diabetic nephropathy, and also some of the vision problems, such as diabetic retinopathy, and glaucoma. Mesenchymal stem cell from fat had proved to be quite effective to differentiate into insulin, somatostatin, and glucagon expressing cell. And here again, if you have enough time, please look at the full text of this review paper on therapeutic potential of mesenchymal stem cell for diabetes. This is also quite a good review paper on mesenchymal stem cell therapy in diabetic mellitus, progress and challenge. It has been quite promising to use stem cell for the treatment of both diabetic type 1 and type 2, especially diabetic complication. This is a review article on mesenchymal stem cell to treat type 1 diabetes. I also would like to explain you about the specific cytokine called adiponectin, which has been discovered in fat stem cell. Adiponectin is responsible to improve insulin sensitivity. So therefore, fat stem cell therapy can be useful for treating diabetic type 2, which has so-called insulin resistant problem. For simple complications like diabetic ulcer, as shown in this patient suffered from wound incurable for more than 2 years. After he received stem cell injection around the wound, only 8 days, all the wound has scarred. So therefore, I like to see that we can save the extremity of the patient suffering from diabetic wound without having to cut off their feet. I also like to share with you about our research experience on mesenchymal stem cell to treat liver disease. Mesenchymal stem cell have been proved to be able to regenerate liver cell in animal models and also can be useful for liver regeneration and tissue engineering. This is the review paper about mesenchymal stem cell therapy for liver disease, which can cover from cirrhosis, alcoholic hepatitis, and also fatty liver. Liver cirrhosis, MSC has proved to be so-called conducting cell for improvement of liver fibrosis and regeneration. Let's continue with Alzheimer's disease. I have found out that Alzheimer's will become a lot of serious problem, especially when our population become the senior citizens. It can be estimated that for those who can live more than 80 years, 1 out of 2 of them will have so-called Alzheimer's disease, which going to affect the individual and their family so much. Now, we have learned a lot of using so-called nerve growth factors to stimulate brain cell, and it can also counteract cholinergic neuronal death, stimulate cell function, and improve memory animal models, and have proved for a certain extent to be benefit in patients with Alzheimer's disease. This is also quite a good review paper on stem cell therapy for Alzheimer's disease, which can prevent memory loss and improve cognitive function. Now, osteoarthritis, inflammation of the knee joint is very common now, and many research have attempted to use so-called PRP, pediatric and mesenchymal stem cell to inject to heal osteoarthritis. with very good result. This is also the paper that review the effect of using mesenchymal stem cell based therapy to treating osteoarthritis. This research done in Australia. The picture of osteoarthritic improvement, pre-treatment, 3 weeks later, and 6 months later, as we can see that cartilage has been repaired. Similar study was shown for those who have cartilage fissure. 6 weeks post-treatment, cartilage fissure has been significantly repaired. The last topic that I like to share with you will be using mesenchymal stem cell to treat stroke. There have been research in South Korea to use autologous mesenchymal stem cell transplant in stroke patients. And the transplantation proved to improve recovery from ischemic stroke in patients quite well. This also a good review on using mesenchymal stem cell therapy for ischemic stroke. And in Europe, there have been a lot of research on current state and perspective of stem cell therapy for stroke. For Thailand, we have about, on average, around 70,000 stroke patients a year. Therefore, we are attempting to help them to recover back. As we all know, that stroke have 2 types, ischemic stroke and hemorrhagic stroke. Both types of stroke do have a good response to mesenchymal stem cell therapy, especially if the treatment can be given within 6 months after the onset of stroke. For hemorrhagic stroke, the results are not as good as ischemic stroke. The major reason because hemorrhagic stroke can have the complication called penumbra effect, which can make the stroke to come back or recurrent. But ischemic stroke usually can be treated with better prognosis. I'd like to end my presentation today by discussing about the development of some stem cell-based products, which have been approved in USA, Canada, and also in European countries. These are quite a few of products. For example, CARTISTEM has been approved to treat osteoarthritis in Korea. And the other one called Mesoblast company has also used Mesoblast as well to treat many other diseases. Prochymal has been approved for treating GVHD, and there are a lot more that you can see. So I want to tell you that the research and development have been conducted in many parts of the world, and therefore we will need to learn more how we are working along with the so-called stem cell-based product. However, please keep in mind that to do the proper research development, it will take a lot of money and a long time to be approved. However, in Southeast Asia, we can start to use so-called stem cell technology that can be readily to be able to apply to patients who cannot be treated by conventional medicine. I like to suggest that we should try to collaborate and work together. And by collaboration, finally, we can help to treat the diseases which have not yet been treated by conventional medicine. I think it's about time that I'd like to ask for you all to ask questions or give some comment, and I try my best to entertain all your questions. Thank you very much for your kind attention.
Thank you very much, John. Thank you very much, Dr. Kampong. And
Okay, any questions, comment?
ဆရာဒေါက်တာပညာအောင်နဲ့ဆရာမဒေါက်တာဣတိစာဝင်းအောင်တို့နည်းနည်းမျက်နှာလေးပြလိုက်ပါလားဒေါက်တာကံပွန်လေးဟုတ်ကဲ့ဒေါက်တာဣတိစာဝင်းအောင်လေးရဲ့မျက်နှာလေးဒေါက်တာကံပွန်ကိုပြအောင်နော်ဒေါက်တာကောင်းသက်ရှိပါမလား
ရှိရဗျ
ဟုတ်အဲ့ဆိုရင်ဒေါက်တာကောင်းသက်ကတော့မနေ့ကလေ session နှစ်ခုစလုံးသူတခြားနားထောင်ပြီးတော့တခြားဆွေးနွေးကြတယ်ဒီနေ့ကိုလေဒေါက်တာမင်းပညာအောင်နဲ့ဒေါက်တာဣတင်စာဝင်းအောင်တို့မှနည်းနည်းဦးစားပေးမယ်နော်ဆိုတော့ဟိုပါလေဟိုပါပေါ့ဒေါက်တာမင်းပညာအောင်အမအရင်ဟိုရွေးလိုက်မယ်နော်ကိုမင်းပညာဟိုပါလေဒေါက်တာကံပွန်ကလေ question and answer ကိုသူကပို့ပြီးတော့ဟိုပါပေါ့နော်ဟိုကြတာဘာလို့လဲဆိုတော့ဒါမှလည်းအမတို့ဟိုပါပို့ပြီးတိလာအောင်ပေါ့နော်အမနာနဲ့နော်ဘာဆိုမလည်း beginner ပဲဒီလားပြောလေ stem cell နဲ့ပတ်သက်လို့အကုန်လုံး beginner တွေပဲဘာမှလည်းဒါဟိုပါလေဟိုတယောက်နဲ့တယောက်လေဟိုတိတာမတိတာတွေကလေဘာမှတိတ်အမဆို straight မေးတာသိရမလားကုလို့ရလားကုလို့မရလားအဲ့လိုပဲဘာလို့ကုလို့ရတယ်ဆိုမှအမကုလို့ရတဲ့ဟာ why ပေါ့နော်ဘာကြောင့်ကုလို့ရတယ်ဆိုတာကိုသူပြောတာတွေအမပြန်ဖတ်တယ်အမခုနနားလေလိုက်တာကတော့လေpost infarct နဲ့ post stroke ပေါ့နော် stroke ရပြီးတော့6 months အတွင်းမှာ stem cell ကိုပေးတင်တယ်လို့ပြောလိုက်တယ်ကိုမင်းပညာအောင်နဲ့မဣတင်စာအဲ့လိုနားလေလိုက်လားမသိ
ဟုတ်နားလေ
ဟုတ်ဆိုတော့အမတို့လေသူ့ကို question မေးအောင်နော်အမတို့ကဒီ heart မှာပေါ့နော် infarct ရတဲ့လူနဲ့ stroke ရတဲ့လူ stem cell ကိုအမတို့က6 လအတွင်းမှာပေးလို့ရှိရင် prognosis ပိုကောင်းတယ်လို့သူကဆိုလိုသွားတာပေါ့နော်ဆိုတော့အမတို့လေဟို topic ကိုကြိုက်တဲ့ topic ကိုယူပါဒါမှမဟုတ်ရင်အမတို့တိုင်းပြည်မှာ common ဖြစ်တဲ့ယောဂတွေ5ခုလောက်ကိုပဲသူ့ကို focus လုပ်ပြီးတော့မေးမလားကိုမင်းပညာအောင်ပြောပါအောင်
ဒီမှာဆိုရင်တော့လေ DM patient တွေလည်းများဆိုတော့လေသူလည်းDM မှာလည်းဟို stem cell သုံးမယ်ဆိုရင်type 1တို့ဘာမှဆိုရင်ကောင်းတယ်ဆိုတော့လေအဲ့အကြောင်းလည်းတော့သိချင်တယ်
ဟုတ်ပြီဆိုကိုမင်းပညာအောင်ရဲ့ topic ကိုအမ diabetes လို့ခေါင်းစဉ်တက်လိုက်မယ်နော်အမတို့လည်းဝိုင်းနားထောင်မယ်လေဟုတ်မဣတင်စာဝင်အောင်ပါလေသမီးက infarct နဲ့ stroke ကိုမေးမလား diabetes ပဲပြန်မေးမလား
ရတယ် infarct နဲ့ stroke ကိုမေးလိုက်မယ်ရှင်
အမကလေအဲ့ infarct ရယ် stroke ရယ် alzheimer ရယ်အဲ့3ခုကိုအမနည်းနည်းစိတ်ဝင်စားဆိုညီမလေးဟိုအဲ့ infarct ရယ် alzheimer ရယ်stroke ရယ်ကိုညီမလေး focus လုပ်ပြီးမေးအောင်နော်သူကလေဟို welcome နဲ့တိလာဟိုရိုးရိုးလေဟို medical professional မဟုတ်တဲ့လေရိုးရိုးဟိုလူတွေရဲ့မေးခွန်းကိုလည်းသူတို့စိတ်ရှိလက်ရှိဖြေပြီးရဲဘာမှအာနာစရာမလိုအမကလေဘာမှလည်းဟို stem cell အကြောင်းလည်းမသိဘူးအမဆိုဟိုကိုလေ medical field မလာတဲ့လူပုံစံနဲ့ကိုထားရိုက်မိတာလေဘာမှလည်းဟိုအမတို့ကြားထဲမှာလေဘာမှလည်းဟိုတယောက်နဲ့တယောက်လေအာနာကြတယ်မလို့တော့ကမ္ဘာအရန်သဘောကောင်းတယ်သိလားဟုတ်ပြီအဲ့ဆိုDr. Kampong, welcome. Now, Dr. Mimpanya and Dr. Itensa appreciate to discussing the question and answer starting. First, Dr. Mimpanya will start a question about the diabetes type 1 and type 2 for the stem cell treatment. Okay. So, Dr. Mimpanya, please.
Dear Sars, thank you for sharing the knowledge about the stem cell therapy.
Okay.
Can So I would like to know whether the type 1 diabetes mellitus can be cured absolutely with stem cell therapy.
Okay, let's start with diabetic type 1, which usually occur in children. This type of diabetic due to pancreatic insufficiency
Yes.
and stem cell, which ready-made to produce insulin-producing cells, can then be very effective in treating diabetic type 1. So we are now doing a lot of research. How can we collect the best source of stem cell? And before we injection into the patient, we need to change them into isolate producing cell before we can give it to them. So therefore, I hope that within 3 to 5 years from now, we can use stem cell therapy to heal diabetic type 1.
Thank you.
type 2ကိုမေးအောင်လေးဆရာ and
As for type 2, does stem cell therapy improve the outcome, the disease progression?
Okay, for diabetic type 2, they are usually due to insulin resistance. The best way to treat this kind of patient is to control their diet and also to support them with some of the medication. However, those who fail to respond after they receive diet control and proper medication, we then can offer them stem cell treatment for control blood sugar. In general, I'm using stem cell not to treat diabetic type 2. I'm using diet control, behavioral modification, exercise to control their blood sugar. However, I strongly recommend diabetic complication to be treated. For example, if I have some patient who start to have kidney failure, when that creatinine start to go above 3 or their GFR less than 20, I will start to recommend them to do stem cell to prevent them from going for dialysis. And for those who have eye problem, I also recommend them to try stem cell to prevent vision problem, as well as heart disease, stroke, and many other peripheral arterial disease. So I strongly recommend to use stem cell for treating diabetic complication, not to try to control the blood sugar by stem cell.
Yes. Thank you for answering my questions.
Okay.
He now now သမီးက your turn နော် hello Dr. Kampon. Now Dr. Itenza will asking about the her interesting about the stroke, myocardial infarct, and the Alzheimer. So please,
Okay.
Dr. Itenza.
Yes.
Good evening, sir. It's such an honor
Good
to join
evening.
this amazing presentation, sir. For me, I have
Okay,
never
thank you.
heard about stem cell therapy, so this is very new for me and such a very, very interesting topic, sir. Thank you for sharing your experiences. Now, I want to ask you about actually for me, I believe that a brain cell is a non-regenerative organ, sir. But after learning from your presentation, wow, it's so amazing that a brain cell can be regenerative by using stem cell. So I want to know how can stem cell therapy treat a stroke patient and like ischemic or hemorrhagic stroke, sir. And you said
Okay.
you told that in diabetes diabetic ulcer, by injecting stem cell around the ulcer sites, it become totally cured. And
Yes.
so I want to know how stem cells can be used in stroke patients to improve their condition, sir. Thank you.
Okay. That's quite a good question. When I taught my medical student 40 years ago, I also told them that brain cannot regenerate themselves. That
Yeah,
information was wrong.
yes, sir.
Brain can also regenerate itself. However, it will take a way long time for the brain to do so. Now, we understand now what need stem cell to grow and generate the tissue and organ, include the brain. We will need to create the environment before we will give stem cell injection. For example, some of the stem cell will work better when the patient have so-called inflammation process. So in case that we have inflammation, it's easier for stem cell to go even into the brain and pass through the blood-brain barrier. We also learn the way how to infuse stem cell properly. At the beginning, around 20 years ago, we would try to inject stem cell by putting in the brain tissue or inject into the CSF. However, the act of injection can be proved to be very dangerous. So we start to learn more how nature induced stem cells to go and pass through the brain barrier. Through continuous research, I can tell you that we can even have the patient inhale stem cell into their nose, and it will go through olfactory nerve and also stimulate the brain as well. So my research hypothesis is that safety must come first, and providing that we give the treatment in the proper manner, we can help the patient to recover. Now, if you have the patient with stroke, usually during the first 2 months, you will need the brain expert to support them. But at the time that they have to come for rehabilitation, I think it's quite a good opportunity to try to recommend them to do stem cell. The golden period will be around 3 to 6 months after stroke onset. If you wait for too long, fibrotic process can happen, and the nerve tissue will become fibrous tissue, and then you will have scar and prolonged muscle weakness. So the sooner the better that we can give the treatment, it will allow the brain and nerve tissue to respond. So I usually recommend the patient to consider to do stem cell around 6 months or after they have the onset of stroke. And with ischemia, it's going to be important to understand that the reason that the patient has stroke because they have lack of blood circulation. So we have learned now to use the stem cell to induce collateral circulation. We call the process of angiogenesis. And we also learned that there are quite a strong growth factor called VEGF or vascular endothelial growth factor that can stimulate blood circulation as well. So with this, we are doing stem cell treatment together with other treatment as well. You will be surprised to learn that when we treat stroke patient, if you compare the group who receive stem cell together with acupuncture, it works much better than doing stem cell alone. So we start to learn now to add on some other technique together with stem cell. So we're not using stem cell therapy alone. Rehabilitation is also very important. We must give them a good rehabilitation training to help them to recover. So in the near future, I would like to have a chance to talk and focus on stroke and Alzheimer. And I will also will give you more explanation how we do stem cell treatment for this kind of patient. In my belief system, I don't want to see them become bedridden. I like to be able to help them to move back to the society as much as I can do. So that's what I can tell you right now. And with diabetic wound, skin is much easier to repair. As you probably can remember that skin turnover rate is around 4 weeks to 6 weeks. So normally it will take only about 4 to 6 weeks for the wound to be healed. And now we have developed the technique by using stem cell growth factor to spray on the wound. We don't even have to inject now. And the stem cell growth factor can separate the skin regeneration as well. So in the future, once we start to work together, we can share the concept and idea. And at the end, the patient will get the benefit from helping them. Any other question?
Thank you for your valuable answer, sir. Thank you.
တမီးက info ကို
Okay,
ပြောမလားသူကတော့ stroke ကိုပြောသွားရယ်နော်
Alzheimer မေးရမှာမ
Alzheimer နဲ့ stroke ကိုတော့infarct ကြံခဲ့လားလို့ myocardial infarct သူပြောသွားလား
မပြောတော့အောင်မညီမမမေးရဘူး
ဟုတ်တယ်နော်အဲ့ဆိုထပ်မေးလိုက်မယ်နော်အမကနေပြီးတော့တိကျင်တဲ့ပုံနဲ့မေးလိုက်မယ်နော်
ဟုတ်
And Dr. Kampon, can we know about the myocardial infarct attack is about 2 weeks after or 3 weeks after we have to take a stem cell therapy?
No, actually, for myocardial infarction, I usually recommend to those patients who fails to respond to conventional medicine. Like they may be too old or too weak to do bypass or even put the balloon. So for those who can tolerate the conventional medicine, I recommend them to go to see cardiologist first. But you also know that there are many patients who are too old and they cannot tolerate the operation. Therefore, we offer that for those who fail to respond. Okay. Now, our treatment will consist only of stem cell infusion into the blood circulation. And with proper preparation of the patient, we can also need to decrease what we call inflammatory response in the body as well. So sometimes I'm using the Thai herbs like curcumin or turmeric extract to decrease the inflammatory process. And that also can help a lot. Therefore, for each kind of specific treatment, we will not use stem cell alone. We also have to use some other products as well.
So, I mean, our focus on the myocardial infarct attack, the concept of giving the stem cell therapy is for 2 directions. One direction is to inflammation process to decrease, and the another direction is for the muscles of the cardiac muscles are totally destroyed, and how we generate it.
Okay, first we have to improve the blood circulation first. So the stem cell with the ability to produce new blood vessel is very important. Okay, and in order to improve and repair dying muscle cell, we will need to give them the stem cell that consists of so-called myocyte, cardiac myocyte. So let me go slow down. If I want to treat heart failure patient, I cannot just give any type of stem cell and give it to them. I need to process in the laboratory to turn them into cardiac myocyte first and give it to the patient. And sometimes we will need the expert to insert the catheter to inject locally directly into the heart tissue. So with this, it's become very complicated for, general practitioner like ourselves. So, but I like to recommend that the cardiologist or the cardiac surgeon, please consider to support their patient by using stem cell that they can do so well by infusing it into the body as well.
So the stem cell therapy for the myocardial infarction is the concept is we are giving the myocardial infarct patient is the new myocyte, is it?
Yes, correct.
So we give the patients to the new cell.
Yes, and hopefully that it can start to go and repair the heart tissue and organs. So I usually offer for those who cannot do heart transplantation or they have to wait for the proper donor to try stem cell therapy first. Like I said, with taking care of this heart failure patient, we also need the strong support team of the heart specialist. So therefore, I will not be the one to do by myself. I usually select the cardiologist to work together with me and offer them the stem cell and recommend them where and how to inject stem cell into the patient. So that proved to be better. But for those who have a ischemic heart, we can support the patient by just give stem cell intravenously. That will be better response than myocardial infarction and safer.
If the patient asking us the prognosis of the stem cell therapy, how do we explain? I mean, depends on the age about 40 with the myocardial infarct, age about 60 with the myocardial infarct, age about 80 with the myocardial infarct. So for the 40, 60, 80 age with the myocardial infarct, if we given them then stem cell therapy, which age is the better prognosis?
Okay, this will be quite technical to be able to answer in short time, but I like the way that we can start. If any of you have some patient who might qualify for doing stem cell, please send them. Please send me the medical information along with the lab test and X-ray or MRI if you have, and then I will write back to you to tell that whether or not the patient will be a good candidate for stem cell. And we can do that even the patient may not be able to do it this time, but at least for learning experience, because patients are not the same. I strongly believe that one heart patient will be different from another heart patient. We cannot use the same pattern to treat them. So let's start by maybe if you are interested in, just send me the information of the patient and I will send back to you. And if they are interested in, we can try to refer them to Thailand or later on, we can work together in Myanmar. I think that might be a good way to get started.
Yeah, thank you.
So if you need information to support Myanmar patient, please send me medical detail first.
Okay.
And if I need more information, I send back to you.
Okay.
And by having all the detailed information, I can outline what would be the benefit of doing stem cell and how much success that we can expect by doing stem cell.
Okay.
This is the thing that we can do in the near future.
Okay.
And I wouldn't mind to have a younger generation to support. I have to tell you that most of the experts, because they have been trained for too long and they have their own ego. So I like to give the including Thai doctors and Myanmar doctors or Lao and so on.
Ah,
And by doing so, we can learn together.
yeah, great.
And I'd be pleased to give you any suggestion or any advice, and we can go from there.
Oh, great.
And hopefully, once we start to form interesting group, I can offer you the online training course on stem cell, which may have about 16 hours that we can pre-record and send to you, and you can learn and study, and then we can decide on the date that we can have question and answer on the lecture that I have given. So that might be more informative.
Yeah, that's great. So Sulura, the me eat inside. Tomorrow, the stem cell လေးမနားလေလိုက်တာတော့သူကဟိုပေါ့ directly ဟိုပျောက်စီဆိုတဲ့ဟာတော့မဟုတ်သူက cooperate လုပ် cooperate လုပ်တဲ့အခါမှာ the physician ရော surgeon ရောဒီ stem cell ရောပေါင်းဟုတ်တယ်ပါဆရာမင်းပညာလည်းအဲ့လိုပဲနားလေလားမသိဘူးเนาะမတော့အဲ့လိုနားလေလိုက်တာဟုတ်
ပြီးတော့ तू ကဟို transplant တစ်ခုလိုပဲဟိုထည့်မယ်ဆိုလို့ရှိရင်လည်း तू နဲ့ကြိုက်လားမကြိုက်လားအဲ့ဒါလည်း तू ပြန်ပြီးဆက်အောင်မှာဆိုတော့တော်တော်ခံ
အဲ့လို transplant ပုံစံတော့မဟုတ်သမီးဟိုမနားလေလိုက်တာတော့လေသူက cooperate ဝင်လုပ်တဲ့သဘောပေါ့နော်အမှန်တော့ယောဂါကိုသူကပြန်ပြီးတော့ဟို survive ဒီလူရဲ့အသက်ကိုပြန်ဆွဲဆန့်မှုအတွက်ကို myocardial infarct ရဲ့လူနာရဲ့အသက်ကိုပြန်ဆွဲဆန့်မှုအတွက်ကို stem cell ကဝင်ဟို cell တွေကိုပြန်ပြီးတော့ဟိုကူပြီးတော့ဒီ growth တွေကိုပြန်ပြီးတော့နှိုးတဲ့သဘောပေါ့နော်ဆိုတော့အဲ့လိုပဲမှနားလေလိုက်တယ်ဆိုတော့ तू အမှန်တော့ disease တိုင်းမှာ तू ဟိုစစ်ကူတိုက်ပေးတဲ့သဘောပေါ့နော်အဲ့လိုပုံစံလို့တော့နားလေအဲ့ဆိုလို့ရှိရင်အခု data compound ကတော့ तू case by case detail ကို तू တေချာရှင်းပြပေးမယ်လုပ်ပေးမယ်လို့တော့ပြောတယ်ဆိုတော့မတ်ဤတင်စာနဲ့ကိုမညာတို့ case တွေပေါ်လာလို့ရှိရင် data compound နဲ့အမားတို့နဲ့စုံပြီးတော့လေဒီ case ဆိုလို့ရှိရင်ဒီလိုရှိအဲ့ဆိုလို့ရှိရင်သူ့ကို stem cell ပေးလိုက်လို့ရှိရင်သူ့ရဲ့ prognosis ကကောင်းနိုင်လားမကောင်းနိုင်လားသူကလက်ခံတယ်သူနဲ့မတို့နဲ့ detail ပေါ့နော် email ပဲဖြစ်ဖြစ် Viber ပဲဖြစ်ဖြစ်သူ1 by 1သူတေချာစိတ်ရှိလက်ရှိရှင်းပြမယ်အဲ့လိုရှင်းပြရင်လည်းမအီတင်စာကိုပညာကိုကောင်းတန်းတော့အမားတို့ကဒီ case တွေကိုနည်းနည်းသိလာတာပေါ့နော်အမ stroke ဆိုလို့ရှိရင်လည်းဘလိုနီးနဲ့ stem cell ကိုပေးတယ်လို့ပါအဲ့ဒါလည်းနည်းနည်းသိလာဆိုတော့သူရှင်းပြတာကိုအမတို့ကနားထောင်ရနေ stem cell ဆိုတဲ့ဒီ science ကြီးကိုအမတို့ကနည်းနည်းဟိုက used to ဖြစ်ပြီးတော့နားလည်လာတဲ့သဘောပဲပေါ့လေအဲ့ဒါလည်းကောင်းတော့ကောင်းပါတယ်အဲ့တော့ဒီကြားထဲမှာမှတကယ်ဟိုပေါ့နော်ဥမာထိုးအမဆွေမျိုးတွေကအမဒီလူကိုမဆုံးရှုံးကျင်တော့ဘူးပေါ့နော်ကဲ stroke တွေပါတယ်ဆိုအမစိတ်ထဲမှာအမအားမရဘူးဆိုတော့ physician နဲ့လည်းအားမရဘူး surgeon နဲ့လည်းအားမရဘူးဆိုရယ် feeling မျိုး patient ကဝင်လာပြီဆိုလို့ရှိရင်အမတို့ကဒီ patient ကိုပြန်ပြီးတော့ stem cell ရှိသေးတယ်ဆိုရယ် knowledge ကိုသူတို့ပေးပြီးတော့ data compound နဲ့ link လုပ်ပေးပြီးတော့သူတို့ရဲ့ hope ပေါ့နော်မျှော်လင့်ချက်တွေကိုအမတို့ဆက်ဆံလို့ရတယ်ဆိုတော့ရှင်းပြလို့ရတယ်အဲ့ချိန်မှာ data compound နဲ့ patient တွေကိုအမတို့ကချိတ်ပေးလိုက်တဲ့သဘောပေါ့နော်ချိတ်ပေးလိုက်တဲ့အခါမှာ data compound ကဒီ patient ကတော့ stem cell ကိုလက်ခံလို့ရှိရင်သူ့ရဲ့ hope မျှော်လင့်ချက်ကတော့အများကြီးကောင်းနိုင်တယ်ဆိုတာမျိုးတွေလည်းဖြစ်လာနိုင်တယ်ပေါ့နော်အဲ့ကြလို့ရှိရင်အမတို့က patient ကိုအဲ့ဆိုလဲ stem cell treatment ယူမလားလို့ပဲမေးပြီးတော့ဆက်ပြီးတော့ဘယ်လိုဟိုလုပ်မလဲလို့မေးတာပေါ့သူ့မှာ clinic ရှိတယ်လေ stem cell clinic so please သူအမဗမာလူကြီးပြောနေသမီးအင်းနေတာနဲ့မင်းမညာဟိုဒရာကံဘွန်အင်္ဂလိပ်လိုနည်းနည်းကူပြောပေးပါအောင်နော်ပြီးရင်မတို့ဟိုဒရာကောင်းတဲ့ဘာပြောမလဲမသိဘူးနော် sorry ဘေးတော့ဝါလေ
ဟုတ်ဘူးရတယ်ဟိုဆွေးနွေးတာနားထောင်ပေးနေရ
ဟိုဆရာကောင်းတဲ့ဘက်ကထပ်ပြီးတော့ဟိုနောက်တစ်ခုကြံသေးလားမေးစရာလေ
ဟုတ်ရပါတယ်ကျွန်တော်မမေးတော့ပါမနေ့ကလည်းတော်တော်မေးတာ
ဟုတ်တယ်ဆိုလိုတာအခုကဒရာကောင်းတဲ့ရဲ့သမီးအင်တင်စာရဲ့ဆရာမင်းပညာရဲ့အမတို့3ယောက်အမနဲ့ဆို4ယောက်ပေါ့နော်အမတို့ကဒါအကုန်လုံး beginner တွေကြီးပဲဘာမှ Q set ရှာမလို့ဒရာကံပွန်ကလည်းအမတို့ knowledge တွေတစ်ခုပြီးတစ်ခုပေးသွားမှာဆိုတော့ဒါအမတို့ကဒါ chance တစ်ခုပဲလေဆိုတော့အမတို့က case တွေရလာလို့ရှိရင်သူနဲ့ဟိုဒီ stem cell ပေးရင်သူ့အတွက်ပိုကောင်းနိုင်လားမကောင်းနိုင်ဆိုတော့သူ DJ တစ်ခုပြီးတစ်ခုသူဆက်ပြီးတော့ လုပ်ပေးသွားမယ်လို့စိတ်ရှိလဲရှိနေဖွင့်ထားပေးရလေဒါပေမဲ့အဲ့ချိန်မှာမတို့ကလည်းဝင်ပြီးတော့ study ဝင်လုပ်လို့ရတာပေါ့နော်လေ့လာလို့ရတာပေါ့သူ့ကိုလည်းထပ်ပြီးမေးခွန်းနေမေးလူနာကိုစားပေါ့နော်လူနာကိုစားအမတို့ကမေးလို့ရတာပေါ့နော်အဲ့ဆိုကိုပညာနဲ့ဤတင်စာနည်းနည်းသူ့ကိုကျေးဇူးတင်တာလေးဝင်ပြောလိုက်ပါနဲ့နော်ဟိုမေးချက်ရှင်လည်းဆက်မေးနော်
ဟုတ်ရမရှိတော့ဘူး
Now they are glad to hear it. You are welcome for them, and you will support the young generations of the new medical professional who are very interested about the stem cell therapy. So they are happy to see you, and they like to say thanks by one. Please, Dr. Mimbanya.
Thank you, Dauda, for today.
Most welcome.
Get them in this up your
Khopon ka ajar.
Hey,
yeah.
in the cup.
Thank you so much for your interesting presentation, sir.
Okay.
I'm so glad to be participate in this presentation and discussion. Thank you, sir.
Okay, you're most welcome. And I also like to have maybe in a few weeks the sessions on anti-aging medicine.
Yeah.
It might be very interesting for younger generation as well.
Yeah.
And also, I think that not only stem cell, you also need to be trained on some additional treatment like IV vitamins. At the time of COVID, I believe in IV vitamin C that can help a lot to the patient. And we also can utilize the products to be administered in a safe way. Like I like to promote using inhalation growth factor to repair lung and asthma by just inhale. So that way a lot of things can do together. So Neela, you can coordinate it on, and we can set up, 1 or 2 series of lecture on the topic that it may be easier to get started than coming to the stem cell for heart disease and so on. Okay, nice to talk to all of you.
Yeah.
Wish you all the best.
Yeah.
Okay.
Yeah. Thank you so much, Dr. Kam.
Thank you so much.
See you. ပြန်တွေ့မယ်နော်ပြန်ဆုံမယ်
ဟုတ်ပါ
ဆိုလေအသက်80ပေါ့နော်အိမ်မှာလည်းအချိန်နေများသူ့သားတွေသမီးတွေကလည်းမတည်ရတယ်လို့လေမတငယ်ချင်းကပြောတာတော်တော်ချမ်းသာနေပြီတဲ့သူကအမှန်တော့ပညာတွေကို तू ကဘယ်လိုခေါ်မျှဝေချင်တာပဲသူ့မှာကြံတော့တယ်လေသူအရန်ပြည့်စုံနေအားဆိုတော့အမားတို့ကဘာဖြစ်တာ chance ပဲလေဒီနေ့ချိန်မှာကော်ဝိုင်းမေးတာပေါ့ဟုတ်တယ်ဆရာကောင်းတယ်လည်းကောင်းတယ်ဒီလာပဲဟိုတည်းကစီလေးတေးချမေးအမသဘောကျဘာဖြစ်လဲအခုအမတို့ဆရာကောင်းတဲ့ဆရာမင်းမညာရဲ့သမီးအင်တင်စာရဲ့အမဆို4ယောက်ဖြစ်လာတယ်နောက်အမတို့လိုနည်းနည်းအဲ့လိုညားတဲ့လူတွေပေါ့နော်ဒါမှမဟုတ်လို့ရှင်လည်းအမခွဲလိုက်မယ် group လေးလေခွဲပြီးလို့ရှင်အမ video file လေးတွေလောက်ထားမယ်တောက်ပြီးလို့ရှင်သမီးအင်တင်စာကိုလည်းပေးမယ်ဆရာမင်းမညာကိုလည်းပေးမယ်ဆရာကောင်းတဲ့ကိုလည်းပေးမယ်အမတို့မဆွေးနွေးဘဲနဲ့တခြားလူတွေဆွေးနွေးတဲ့ file လေးလည်းအမတင်ပေးထားမယ်ပြီးလို့ရှိရင်အဲ့ဒါတွေကိုအမတို့ကနားထောင်ရင်လည်းအမတို့လမ်းလောက်တာပဲပေါ့လေဟုတ်တယ်မလားဆိုတော့ကဲနောက်လူတွေဝင်ပြီးဆွေးနွေးကြတယ်ဆိုလို့ရှိရင်လည်းသူတို့ group တက်ပေးလိုက်မယ်လေပြီးပြီးသူတို့ဆွေးနွေးတာတွေကိုလည်းအမတို့ကသူတို့ video တွေကိုပြန်နားထောင်မယ်လေဟုတ်တယ်မလားအဲ့ဆိုအမတို့နည်းနည်းဟိုပေါ့သတင်းနားထောင်တယ်လို့ပေါ့နည်းနည်းတော့ up to date လေးကြားဘူးနားပါဖြစ်ပြီးရွှီလို့ရတာပေါ့
ဟုတ်နည်းတိတာပါဒီနေ့
ဟုတ်တူ arthritis တွေပါလေဆိုကstem cell ပြီးပါလားတော့နဲ့ရှူဝင်ရွှီလို့ရအဲ့ဆိုကိုရဲ့ဘေးကလူတွေကဘာလဲ stem cell လို့မေး stem cell တော့ stem cell ဆာမီစင်ခိုင်ပါပါနည်းမှောက်လိုက်
ဒီစားရ stem cell
diabetes လေ type 1ဆိုလို့ရှိရင်ပေါ့နော်အမစဉ်းစားtype 1ဆိုရင် insulin နဲ့ဘာလို့ဝယ်ထိုးနေမလဲပေါ့သိရမလား complication တွေဘာလို့ဖြစ်ခံနေမလဲမအမျိုးထဲမှာရှိရ type 1နေသူဆိုဟိုလောက်အသက်20အစိတ်လောက်ကလေး type 1ဝင်ပြီး insulin ထိုးတာအဲ့ဆိုခင်ဗျာတွက်ကြည့်လိုက်ပေါ့နော် insulin ဘိုးနဲ့ခင်ဗျာ complication တွေနဲ့ခင်ဗျာကုန်ရမယ့်ဟာခင်ဗျာ stem cell ထည့်ကြည့်ပါတော့ဒါဟိုလေး idea ပေါ့နော်အဲ့ကြောင့်ရှင်ကလည်း သူတို့စိတ်ထဲပေါ့ဟာဒါဆိုရင်ငါတို့ရဲ့ life ကပေါ့နော်နည်းနည်း change
ပြန်
ဖြစ်
ပြောင်းသွားလား
and hope ရတယ်ပေါ့နော်အဲ့ဆိုရင်လုပ်ကြည့်မယ်ပေါ့အဲ့ကြလို့ရှိရင်နေခဏနေဦးငါတို့ဒီဘက်မှာ export မီတော့ကြကြားရနေလေဟိုကိုကအပြောပဲဖြစ်သွားမှာဆိုတော့အဲ့ကြတော့ဘက်ကနေအဲ့ diabetes type 1ကိုလုံးဝပျောက်ရှင်တဲ့လူကြီးကိုခေါ်ပြီးခင်ဗျားရဲ့ story ကဘယ်လိုလဲဘာညာပေါ့နော်ခင်ဗျားရဲ့ history တွေပါ maybe ဒီဘက်ကဒရာကမွန်ကြီးကိုခေါ်ပြီးဒီမှာဒရာကမွန်ဒီလိုတော့ဖြစ်နေပြီခင်ဗျားအဲ့ stem cell ပေးရင်တကယ်ရောပျောက်ပြီလားဘာညာပေါ့နော်အဲ့ချိန်လူနာလည်းစိတ်ပါပြီကုတော့မယ်ဆိုလို့ရှိရင်အဲ့တော့ကုခိုင်းလိုက်ပြီကုခိုင်းပြီးပြန်မေးရမှာပေါ့ဒီကမလားဟာကျွန်တော်တို့ကုခိုင်းလိုက်ခင်ဗျားတကယ် type 1ပျောက်သွားပြီဒါဟိုရိုးရိုးလေးပဲလေဟိုအပြင်လန်နဲ့ပြောတာလေအမတော့အဲ့လိုမျိုးပဲဟိုနောက်တကယ် detail အမတို့ဒီ science talk တွေကြတော့အရှင်းပြောရအမလည်းတချို့ဟာတွေသူပြောမှသိတာအဲ့ဟိုဟာတွေသူတို့ကဟိုဟာ research လုပ်ပြီးမှထွက်လာတဲ့ဟိုအတုံးနှုံးနေလေတချို့ဟာတွေဆိုလို့ရှိရင်အဲ့ cell လေးတွေကိုနာမည်လေးတွေပေးထားတာဆိုလေအမမသိဘူးအဲ့ဒါလေဟိုကိုသိတာဟိုဗာလဲ blood ထဲကဟို platelet လို့ group အဲ့လိုပဲတည်တယ်အဲ့အခုဟာသူတို့လေးအတစ်ကလေးတွေပေါ်နေနောက်တစ်ခုကဆရာမင်းပညာရဲ့ဤတင်စာရဲ့ဆရာကောင်းရဲ့ကိုအမ information တစ်ခုပေးချင်တာအမားတို့ကဒါလူငယ်မှုလို့မသိတာလူကြီးတွေစာအရန်ဖတ်တဲ့ပေါ့နော်ဥပမာအမားတို့ retired professor ကြီးပေါ့90 80ကို short မတွင်နဲ့နော်သူတို့ဘာလိုက်ရှာနေလဲသိလားအဲ့ anti aging ကိုလိုက်ရှာနေအဲ့ anti aging ကလေ journal တွေထဲမှာရေးနေပြီအမှန်တော့နှုတ်ပြအောင်ပေါ့နော်အဲ့ဟာလေအမတို့ဆရာဝန်ကြီးတွေထဲမှာလည်းသုံးချင်တဲ့လူတွေပေါ်နေပြီခုကဒရာကံပွားကသူ anti aging ကိုလည်း topic တစ်ခုနဲ့သူတေချာဆွေးနွေးမယ်လို့ပြောတယ်အဲကြလို့ရှိရင်အမတို့ကလည်းဒါအမတို့ရဲ့ဒီ retire ဆရာကြီးကိုအမတို့ကြံကြံပေးလို့ရတယ်ပေါ့ဟာဆရာကြီး anti aging တော့ရှိရဆရာကြီးစိတ်ဝင်စားဘယ်သူကောင်တော့ပြန်နှုတ်ပြချင်တာအဲဆိုလို့ရှိရင်ဟုတ်ပြီပေါ့အဲဆိုခင်ဗျားဘယ်လိုဟာလဲပေါ့အဲနေဖို့ကျွန်တော်ဒရာကံပွားကိုမေးပေးမယ်ဟုတ်ပြီရပြီနော်
ဟုတ်ပါ
ဟုတ်ကဲ့အဲ့ဆို see you နော်မတို့ဒီ၄ယောက်ဖွင့်ထားလိုက်မယ်နော်ဟုတ်ကဲ့ဟုတ်ကဲ့see you ဟုတ်ကဲ့ see you ဒရာကောင်း see you ဟုတ်ကဲ့ရပြီကောင်းတယ်ဟိုမင်းကြီး